Hi, my name is Dr. Scott Perryman with Whole Health Weight Loss Institute. Welcome to our informational seminar. This will serve as your introduction to bariatric surgery. If you're looking at this video, you're considering one of the greatest changes of your life. You may therefore experience significant psychological resistance to this change, and remembering the following words may serve to help you. Grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. May these words help you to continue to find the courage to make the changes you can, to make this change. Over the past several decades, there's been a very concerning trend in the United States. There has been a continual rise in the prevalence of obesity in U.S. adults. It's illustrated here by this graph. The current obesity rate in the United States is 38%, the highest it has ever been. There are several clinical effects associated with obesity and several diseases, such as diabetes, hypertension, obstructive sleep apnea, arthritis, and yes, even cancer. There are also psychosocial aspects associated with obesity, such as decreased college acceptance rates, less advancement at work. Obesity may affect your self-esteem and affect relationships. So what is the best approach to tackle this challenge? Is it diet, exercise, medication, surgery, psychotherapy? Well, in a word, yes. The best approach is all of these things. And that brings us to the whole health paradigm. Diet, exercise, surgery, group support, and mindfulness, all bringing you to your whole health, helping you achieve your whole health. Let's begin with diet. When patients come to see us at Whole Health Weight Loss Institute, we will do a diet and lifestyle analysis. This way we get to understand you and know your challenges. You will have a one-on-one consultation with our dietitian, and this will help you to learn important things like how to read food labels and how to make different choices in your diet from day to day. This will lead to your overall success. We also look at exercise as an important and vital component to your weight loss program. Your whole health team will help develop a post-operative exercise plan, and your exercise plan will be reviewed at every visit. Whole Health is partnered with a medical fitness center, Synergy, in Napa, California. Synergy is staffed by exercise physiologists who are dedicated to your success. Once you develop an exercise plan, then it's much easier for you to execute it. And execution will be in the form of at least 20 to 30 minutes of exercise every day. Remember, if you fail to plan, you can plan on failing. This brings us to surgery. Surgery is an important part in the management of morbid obesity. We offer several different operations and procedures. The most commonly performed procedures in the United States are the vertical sleeve gastrectomy and the Roux-en-Y gastric bypass. We offer both at Whole Health Weight Loss Institute. Patients often wonder how they qualify for surgery. It's based on the body mass index. The body mass index is a measure of your weight relative to your height. The equation is listed here. The weight is in kilograms, the height in meters squared. To qualify for surgery, your body mass index must be greater than 35 with a weight-related medical problem such as diabetes, high blood pressure, high cholesterol, sleep apnea, arthritis. Or your body mass index must be greater than 40 with or without medical problems. Once you qualify for one surgery, you qualify for all. The vertical sleeve gastrectomy is the most commonly performed procedure at Whole Health Weight Loss Institute. It involves removal of the outer 80 to 90% of your stomach using a specialized stapling device and a laparoscopic, minimally invasive approach. This removes an important production center for the hunger hormone ghrelin. This is our most important hunger hormone. So patients have a decreased hunger, which is the metabolic effect of the surgery, and experience an earlier satiety based on the restrictive part of the procedure. This surgery is very effective with 65 to 70% excess body weight loss at 1 year. The surgery is also effective at treating diabetes in the morbidly obese population, with remission rates of 80 to 90%. It will also effectively treat obstructive sleep apnea, remission rates ranging from 70 to 75%. It improves blood pressure control, improves control of cholesterol and triglycerides, and decreases or resolves arthritis pain. Clearly, it's a very effective surgery. Let's look at some of the results from our patients. I believe they speak for themselves. The vertical sleeve gastrectomy is not without complications. Patients may develop a leak with a severe systemic infection. This may occur up to 12 weeks post-op. Patients may develop severe GERD, both short or long-term. Patients may develop stricture, which is narrowing of the stomach. And with the narrowing may come persistent nausea or vomiting. And these complications may lead to conversion to Roux-en-Y gastric bypass. Other risks include deep vein thrombosis or pulmonary embolus, which is the leading cause of death for these operations in the United States. Injury to the spleen may occur during the procedure, and this may require splenectomy, and patients may also have significant bleeding requiring a blood transfusion. The vertical sleeve gastrectomy is an irreversible procedure. The absorption should be normal for these patients since we do not alter small intestine anatomy, and most vitamins and micronutrients are absorbed in the early portion of the small intestine. So vitamin and micronutrient deficiencies are rare. The operation is well tolerated. It has a lower risk of complications, both short and long term, when compared to the gastric bypass, with a shorter hospital stay. The hospital stay is typically 1 night. No dumping syndrome occurs in the sleeve gastrectomy. You may be asking, what is dumping syndrome? When patients eat concentrated sweets or foods high in sugar, there's a rapid rise in blood glucose. Next, there's a rapid rise in insulin, which then results in a rapid drop in blood glucose. The rise in insulin is more pronounced if food enters directly into the small intestine, as it does in a Roux-en-Y gastric bypass. Symptoms of the sudden hypoglycemia that results from the rapid rise in insulin include sweating, palpitations, abdominal discomfort or bloating, and or urgent diarrhea, so-called dumping. This syndrome occurs with the Roux-en-Y gastric bypass. The Roux-en-Y gastric bypass is the gold standard bariatric procedure. It was first performed in 1966. It involves creation of a small pouch of stomach, which is carved off of the normal stomach. The pouch is 1 to 2 ounces in size. The lower small intestine is then cut and reconnected to the new small pouch of stomach. This results in bypass of the majority of the stomach and part of the small intestine. The bypass leads to poor absorption of food, particularly fat. Patients therefore lose weight by 2 mechanisms: malabsorption and restriction. The weight loss with the gastric bypass is quite significant. Patients will lose 70 to 75% of their excess weight by 1 year. Vitamin and micronutrient deficiencies are more common due to the malabsorptive nature of the gastric bypass. This surgery has a greater risk. It's more technically challenging. It has a longer anesthesia time. There are more long-term complications. Some of the risks include anastomotic leak, which is a leak at one of the intestinal connections. Anastomotic leaks will lead to an infection, and often a systemic one, which we call sepsis, bleeding, deep vein thrombosis, pulmonary embolus. All of these are possible risks. Long-term, patients may develop ulcers or internal hernias as well. There's a longer hospital stay of 2 to 3 nights with the gastric bypass, and as previously mentioned, patients can develop dumping syndrome. The significant risks associated with stapling procedures led us to search for incisionless options. And so we come to the intragastric balloon. In this procedure, which is indicated for obese patients with BMIs between 30 and 40, a silicone balloon is delivered into the stomach using a flexible camera. The balloon is inflated with sterile saline to the size of a grapefruit. The balloon will then occupy space and slow digestion. Patients lose approximately 25 to 30% of their excess weight by 1 year post-surgery. This translates to about 3 times as much weight loss compared to diet and exercise alone. There are no incisions, as this is an endoscopic procedure, which means a fast recovery. It is performed as an outpatient for both the placement and the removal at 6 months post-placement. You can have a repeat treatment with the intragastric balloon. There are few complications, but because it is a new procedure, it is cash pay only. The intragastric balloon complications go from minor to major. The most common minor complication is nausea. Vomiting, abdominal pain, and gastroesophageal reflux can also occur. Major complications include device intolerance, dehydration, obstruction, perforation with sepsis, aspiration pneumonia, abdominal cramping, and infection. And so now that you've heard of all of these different operations and procedures, you're probably wondering, well, which one is best for me? Well, it does depend on your medical problems. It depends as well on certain anatomical considerations, which may limit your choices. Also, medication needs need to be taken into account. And so when you see your bariatric surgeon, all of these things will be discussed, and the best operation for you will be offered. After surgery, support will become very important. We have a patient-led support group which we offer monthly. It is run by our patient, Mr. Robert Waddell, who's illustrated here on the left. The importance of support in managing any addiction, particularly a food addiction, has been well studied. Dr. Kaner mentions the importance of support in the collapse of the self and its therapeutic restoration. She also touches on something very important in her statement: the importance of the presence of mind, which we call mindfulness. Mindfulness is something that is often discussed, but is not well defined. Mindfulness involves development of psychological and emotional awareness. Our patients learned how to practice mindfulness in their daily lives. We believe that mindfulness is critical to prevent weight regain and long-term failure. And so it is taught by all of our practitioners at Whole Health Weight Loss Institute. We also understand that there's a difference between understanding or knowing about mindfulness and actually practicing mindfulness. And so what is exactly the practice of mindfulness? Maintaining focus on your thoughts and actions throughout the day, particularly in challenging moments when you are triggered, is the practice of mindfulness. Being aware of your emotional state throughout the day, and particularly in challenging moments, is also the practice of mindfulness. It is important to be aware of the connection between your emotional state, your thoughts, and your actions, so that you can learn to create distance between your emotions, your thoughts, and your actions, and so that you can choose deliberate, conscious, and healthy actions when it comes to diet and exercise. And this is the practice of mindfulness you will learn at Whole Health Weight Loss Institute. Remember, knowing about mindfulness is not practicing mindfulness. You must practice. In the same way that knowing about exercise and actually exercising are not the same thing. Practice is paramount. Bariatric surgeons. The preoperative workup for bariatric surgery is listed here. It is extensive, but it is critical to your success. All of our patients see our dietitian, see a psychologist, and all of our patients undergo an upper endoscopy and see a cardiology for evaluation. It is time to act. Call today and start your journey towards a happier and healthier you. Emerge, transform, and transcend. I'm Scott Perryman with Whole Health Weight Loss Institute. We look forward to meeting you soon. Please enjoy the following inspirational story of one of our patients.
Kind of inspired you. You inspired her. She had surgery
Correct.
to lose weight herself, but I think we have some video of that we wanted to show everybody.
Terrific.
My mom started encouraging me to do this as soon as she did hers.
all the time was Miley. I wish you could feel how amazing I feel, and you should totally do this. I was a major soda addict. My weight had got to a point where I just couldn't handle it anymore. I had a hernia that I needed to be repaired, and my surgeon said, "You're too heavy. I won't do surgery on you." I weighed 343 pounds. When I told my mom that I was going to have bariatric surgery, she was completely happy. She started crying over the phone. Having my mom's support felt wonderful. She knew how hard the after part of the surgery was. She was taking care of my kids. She was taking care of me. I lost 146 pounds now. I walk daily, eat way healthier than I ever did before. When everybody sees me, they're like, "Wow, you look like your mom." It's a really big ego boost. My one encouragement all the way through was my mom. And this, my new person, is my thank you to her.
Well, that's impressive. So you've inspired your daughter. Have you seen her since she lost all her weight?
No, I keep on telling her to send me pictures, so I haven't seen her at all.
Because you're in Hawaii and she lives in Sonoma.
Correct.
Do you think you'd even recognize her if she were to say, I don't know, walk into this studio right now?
She saw my father, and my father said she could not recognize her.
Really?
Yes.
I wish Miley were here right now.
Oh.
I wish she would go ahead and walk in. Miley, are you here? Here she is.
Oh, I love you so much. I don't recognize you.
Well, let's see you, Miley. Let's face the cameras and show the world how gorgeous you are.
Wow.
Oh, welcome.
Oh my goodness. I just haven't looked at that.
Are you shocked?
I am.
Have a seat, ladies. Have a seat.
You need to talk to me so I recognize you.
Hi, Mommy.
There we go.
You know, you didn't even know that you were here. You coordinated your outfits. That wasn't even planned.
Yes. Wow.
Miley, we just heard you talking about how your mom inspired you so much. What does it mean to you to be here and for her to see you in all your gorgeous glory?
My mom, I just wanted her to have this gift, and I'm just so happy that I can share it with her.
Oh.
I love my daughter very much.
Well,
I'm so happy for you.
Well, you've made our day just getting to see your beautiful relationship, your beautiful selves. We have a little other surprise for you, Miley. You don't know about this. Roll on in. We're giving you a whole bunch of new clothes in your smaller sizes.
Oh my God.
And a shopping spree at Macy's.
Oh my God! Oh my God!
So I guess I know what you ladies are doing this afternoon.
Yes, definitely. Oh my God.
Abby and Miley, happy Mother's Day to both of you. And congratulations.
So much, Savannah. Happy Mother's Day to
Oh,
you.
thank you so much. Well, you guys really are an inspiration.
Thank you so much.